We're at the IAS, and we're here with Alain, who is a recipient of a CIPHER grant award. And we appreciate your taking the time to visit with us on this. And first of all, before we get started, give us a little bit of a full name and or affiliations with which you're representing here.
Thank you very much for being here. So my name is Alain Amstutz, and I have kind of two roles. I conduct a PhD in clinical research for the Swiss Tropical Public Health Institute under the lead of Niklaus Lapphardt. And I also work as a physician for a Swiss-based NGO in Lesotho that is called Solidar Med.
Now, what is the work that you actually made the award for? Tell us about that.
All right. So the award, the received the CIPHER award, is for a project among HIV-positive adolescents. And the idea is to improve the 1990 care cascade among HIV-positive adolescents in Lesotho, which is a high prevalence country with HIV prevalence, adult prevalence of about 25.6%. And if you look at the adolescent HIV care cascade, the outcomes in each cascade is just much worse than compared to other age groups, and that's why we now try to shift and focus more on adolescents.
Mm-hmm. And how will you go about this project? You're going to, is this what kind of a trial is it? What kind of a project is it?
I think in order to understand this piece of operational research, let me quickly go into the setting that I work in. So Lesotho is a small country within South Africa, right. High up in the mountains, all above 1,000 meters. And prevalence is very high, and important is that the majority of Lesotho, more than 70%, live in rural areas, in villages scattered around this mountainous area. So accessing care is a major challenge and is one of the biggest structural barriers in the whole HIV care cascade. However, if you look at adolescents, other barriers are much more pronounced than just the structural barriers, because we did a lot of research, operational research about structural barriers in adults, but we didn't really have a good model for adolescents. So we sat down, we have a brilliant local team, Lesotho, and young adults in there as well, and we developed a model that we call the PEBRA model. That stands for peer educator-based refill of ART, and we're going to try that model in a cluster randomized design. That's it, yeah. And
how do you get around in an area like? I mean, is it you that's getting around, or is it the population that's having to come to you for to refill prescriptions and so forth?
Yeah. So that's exactly the main innovative pillar that we include in this model. There's 3 pillars in there, and the main pillar is that HIV-positive adolescents can get the ART refill at the village health worker, facilitated by the peer educator, and they only have to access or go to the health center every 6 to 12 months. So that's the main innovative step, and we're already working with such a model of decentralized ART refill with adults, and now we tailor it for adolescents. Right. And then there are 2 other pillars in there. Second one is a psychosocial support group run by another implementation partner with mixed HIV-positive and negative adolescents in the community. So all of it is a very community-based approach.
That's focused at prevention and treatment? Is that
yes, yes, and inclusion, decreasing of stigma within the community itself, exactly. And the third pillar is an SMS-based intervention. It is very rural, our setting, but access to phone and SMS is not a problem, and we have a viral load database, so everyone who gets a viral load goes through our database in our study districts, and we can send out automatic SMS based on viral load result, can trigger these messages. So that's why we really think we cannot just go with one intervention, rapid ART initiation, and we can assume good retention in care or good adherence. We really need to provide more, especially for adolescents, and that's why we propose this differentiated, decentralized, multi-component model that we're going to try out in a cluster randomized design.
Do you see any options or reasons that you might see to change the way in which you're putting this together? I mean, it seems like there's there's so much room for change and so much room for design or modification. And I don't know if you can do that within the trial or you have to do some sort of an update. But it seems like this is a really complicated thing. But how many centers are there? There's like 13, did you say? Or
No, so there are, we work at 22 health facilities.
22, okay.
But we exclude the hospitals because they already have the adolescents interventions. It's really a model decentralized at the rural health centers for these adolescents.
And,
So we're
and
not-
all of these adolescents have no problem getting to those rural centers.
They do,
They do have problems.
They do.
Okay, all right.
yeah, they do.
Okay. So it's a very, I'm trying to get a picture of the geographic
Yeah.
scenario. It's a pretty big landmass
Yes,
in the mountains that you're talking about.
yes,
And even though they can come to these rural centers, it's still difficult in traveling to those.
yes,
Even though
yes.
there are as many as 22.
Yes, I mean, just to give you an example, we're currently right now running another door-to-door based HIV testing and counseling campaign for another study, but we take a lot of this knowledge out now to the CIPHER project study. And when we go to Mochotlong district, that's the district, the very mountainous district that we are in as well, we usually travel with the team, take a car from the district hospital, so kind of the capital of the district, travel around an hour and then walk another hour until we get to the village.
Wow.
So
there's not even a road that gets
exactly.
to the, yeah.
Whereas already in the other district where we are, you can access with a 4x4, you would get to the village. But so we work in a very rural setting. It's very different to Cape Flats, Cape Town, Johannesburg area. KwaZulu-Natal, Drakensberg is maybe a bit similar, but Lesotho itself is very rural.
I guess when we first came upon the need or the perception of the need to treat all the people in Africa, everybody said, they can't tell time, they don't have a watch and whatever. And we never realized all of the intricacy and the logistical issues that would be facing the effort and or that were critical and that you're finding out. So this is really worthy. It's obviously you got a grant, so it must have been worthy. But it seems like this will be interesting to see how this pans out, how you deal with this. So I'm excited to see the results. Yeah.
Thank you very much.
Thank you for being here.
Thank you so much.